New South Wales had 2 more COVID-related deaths and a record number of cases. It's the largest number ever recorded by an Australian jurisdiction in a 24-hour period. Antoinette Collins reports from Sydney.
Well, it's been another new daily case record here in New South Wales of 1,035 cases. That's up quite significantly from yesterday's figure of 882, but we have been warned to expect these numbers to bounce around quite a bit. We are expected to see higher numbers as transmission continues to spread, especially in those areas of West and Southwestern Sydney. There have been 2 more deaths. A woman in her 70s died at Nepean Hospital, having contracted the virus in the hospital, and she's the 4th death now associated with an outbreak there. And a woman in her 80s from Western Sydney died at Sydney's Westmead Hospital overnight. In some positive news, there's been more than 156,000 vaccinations across New South Wales yesterday. There was a record number turning out at the state's vaccination hubs, but there has been a bit of a technical complication with people trying to register their children aged between 12 and 15 for vaccinations after the updated advice from Otago yesterday. Some parents jumped online and managed to make bookings for their children, but then were later told by New South Wales Health that those bookings aren't yet open for people in that age bracket. And there was a technical glitch. New South Wales Health has apologised for that, saying it was a combination of factors. Some people were given the wrong link, but made them pass the eligibility checking function of the online application process. Those people now won't be able to get vaccinated until a little bit later on in September when those bookings open. In other good news, weddings will now be allowed to go ahead from Friday, but with only 5 guests in attendance. And Health Minister Brad Hazzard was very cautious in the fact that big weddings can be super spreader events.
We've had circumstances where weddings have actually been massive super spreader events. But more importantly, just bringing large groups of people, your friends, together at the present time is dangerous. It's just dangerous. So what we've done is we've found a balance, and the balance is obviously the couple can get married with 5 people present and those who are necessary for the service, and I think that's a reasonable balance.
Now, we also heard from the New South Wales Ambulance Commissioner Dominic Morgan at today's press conference, who was detailing some of the pressures really being felt by paramedics at the moment. Yesterday alone, paramedics treated around 450 COVID patients or suspected COVID patients, and that is putting a lot of pressure on things like 000 calls. And he was making an appeal to people to really only use that 000 emergency call for actual health emergencies. He was detailing how some people were ringing up paramedics to try and get food delivered to loved ones or to take loved ones to vaccination appointments, for example. And he was really urging the public to think about whether they need an ambulance or not, because they are really experiencing very high workloads, similar to that seen in New Year's Eve celebrations.
Last night was the 2nd ever status 3 alert that New South Wales Ambulance has ever had. I need to convey that level of criticality to you. Status 3 means that we are seeing impacts in our ability to respond to the community. When we receive calls that do not require an ambulance immediately, it can have dire consequences. I have been advised this week that we had a 25-minute response to an 18-year-old cardiac arrest. This is devastating.
So yes, pressures are really being felt by the health service now here in New South Wales, especially in the west and southwest of Sydney, where we have been seeing delays in ambulance drop-off times at places like Westmead and Blacktown Hospital. So a big concern for authorities here in New South Wales.